Hello everyone, I'm Dr. Susan Sarajari from Dominion Fertility, and I don't know if you saw, we recently posted a blog about the ERA assay, which is also called the endometrial receptivity array, on our website, and I wanted to just take a minute and talk a little bit about it. It's actually a really nice tool to kind of figure out when the right time is to put an embryo back in a woman's uterus. And basically, every woman has what we call a specific window of implantation, and that can be very different for each woman. And this endometrial receptivity array is trying to figure out when the right time is for each woman to put this embryo back in, and basically allowing us to do a personalized embryo transfer, and this way improving pregnancy success rates. The science behind it is that we basically take a little sample from the inside of the uterus at a time when we feel is the right time for the embryo to implant, and we send that sample out, and the sample is analyzed for over 200 genes that pertain to implantation, and then we get a report back, and basically it can say, well, the inside of the uterus is receptive for the embryo. And so with the next cycle, we can basically duplicate all we did and put the embryo in at the right time. Or we can get a result saying, no, it's not receptive. And then it can actually tell us specifically, look, you need to transfer the embryo maybe a day later, 12 hours later, and so forth. And we can adjust and then transfer the embryo at the right time. And this has actually been shown to improve, in some studies, pregnancy success rates of over 85%. So it's a really great tool, and it's particularly useful for women who have had implantation failure with embryos that were chromosomally normal, and the endometrium otherwise looked fine and was thick enough, but they just didn't get pregnant. So that's something to keep in mind if you're in that situation, to maybe ask your doctor about doing an ERA assay.